Conference in Nairobi that the maternal mortality in the country remains unacceptably high and that the time for incremental steps has passed. His remarks come in the backdrop of high neonatal deaths in Kenya, where a baby dies every 15 minutes in the country.
We must confront reality with honesty and urgency. Maternal mortality remains unacceptably high. Newborn deaths and stillbirths have persisted. This is not only Kenya's challenge, but a shared global challenge.
Every day, every day, we lose 92 newborns. People who have not started life are lost.
She holds her premature baby against her chest. The infant's tiny body nestles skin to skin beneath her hospital gown. This is kangaroo mother care, a simple yet powerful intervention where mothers become human incubators using their body heat to regulate their baby's temperature and heart rate.
The main conditions that we manage in our newborn unit are prematurity and birth asphyxia and also neonatal sepsis. So for prematurity, you find that once these are babies who are born before their due time. How we can prevent this from occurring is having our mothers go to the antenatal clinic and having a proper follow-up.
This life-saving intervention works when babies survive long enough to receive it. Many don't make it that far. Every day, 92 newborns die in Kenya, adding up to more than 33,000 lives lost each year. Put simply, a baby dies every 16 minutes.
If you look at the data generally, at least what we know is that the causes are either infection, this, of course, within the health facility. It can be congenital disorders that the children have, or it can be, problem with respiration and all that, so asphyxia, trauma, and all of those things. There need to be an assessment at counties and at national level in terms of what really drives those deaths in different facilities.
There is a common thread here: overstretched and under-resourced care. For some newborns, survival comes down to the few minutes of attention a nurse can spare. One doctor broke it down.
KEMRI has told us that on average, one nurse spends about 3 minutes with a baby in 24 hours. 3 minutes is all a baby gets of care from a nurse. I'm not even beginning talking about doctors because that is way worse.
3 minutes of care in a full day is just one glimpse into the pressures inside newborn units. But the reasons babies die stretch far beyond staffing. It is one of the reasons why interrogating Kenya's own data is critical to finding solutions.
As many other countries in Africa has access to a platform, the HMI system platform, where they have data on the causes of death and also data on the occurrences of death. So they have to interrogate that data and really understand and making sure that whatever the learning that they're making is used to actually interventions. Kenya still has a high neonatal mortality, but I will not compare Kenya to other countries. I think it's just perhaps I will say compare Kenya to itself, and it is its commitment for this every mother and every child survive, no matter where they are.
Turning grief into change is the promise of Kenya's Maternal and Perinatal Deaths Surveillance Response, or MPDSR. Every death should not just be mourned, it should be studied to prevent the next one. Kenya has embraced data as a tool for change, but the real test lies beyond policy papers in Nairobi. It is whether the lessons reach the bedside in county hospitals where lives are lost every day.
Kenya is one of the countries that is actually leading the way in terms of using evidence for decision making, which is good. As I said, they have been part of the Countdown to 20 initiative for years now, and they're very committed to learn, to look at the performance, but this has been done really largely at the national level. So there needs to be a lot more being done at subnational level, because the indicators can change at national level, but there's some counties that still have rates that are higher than the national average. So those counties need also a critical learning and performance analysis.
From Nairobi to Lagos, from rural clinics in Garissa to district hospitals in Malawi, the fight for newborn survival is being waged against the same barriers: too few nurses, ill-equipped facilities, and preventable deaths that should never happen. For the Frontera Originals, I am Anne Mawathe.